Number 2 is make healthcare systems sustainable, investing in innovation that is both cost-effective and valuable. Richard,
yes.
30 seconds, that is 2 minutes.
Okay, thank you. No, so I would even say, in my personal words, that it's the innovation that matters. We heard that yesterday from several speakers that talked about, innovation has to meet unmet need and has to add value. Okay, so I think this has to be reflected in the roadmap. I think we're moving very quickly towards European collaboration on the assessment of added value or added clinical value of technologies, medicines and devices, maybe medicines before devices. This will be very important for member states when they negotiate prices and also they decide on the scope of access in each country. So we can accelerate access to medicines by having much more European collaboration after the EMA approval on relative efficacy and effectiveness. We will need to continue to seek patient involvement across the innovation chain. It's already underway. The EMA, European Medicines Agency, is doing a great job in recruiting patients into the advice process, but there's a lot to do, particularly also when we involve health systems and payers in the last mile, as I mentioned earlier. We need to continue to make sure that we benefit from patent expiration and loss of exclusivity of products, as we call it in the biologic space. The biosimilars, with the arrival of biosimilars, we have huge savings potentials, and we need to do this in a careful way, which is acceptable to healthcare providers and to patients. But there's a huge potential for Europe, and we actually had other parts of the world here. So it's with envy that other regions look at Europe, that we can actually benefit from biosimilars earlier than others. Okay. We also need to leverage, which we didn't discuss so much at this meeting, we didn't have time, but is the European semester and the various instruments for making health systems efficient. And even if some of us, maybe not in this room now, but some of the people in the healthcare and public health community, it kind of doesn't want to be involved in this because it's about money and it's not nice. But it's a vehicle, it's an opportunity. And we have to be very clever how we leverage both the WHO Europe agenda and the European Commission agenda with clear mandate from President Juncker on what to do and not to do, right? So we have to be clever and use the mandates there are, So performance-based, high-performing health systems is the term that's been coined a long time ago, and it's still valid, and we have to intensify that work, okay? We talked about data a lot. We have to talk about the secondary use of data or reusing existing health data. We've heard that a lot of the data is already there. There'll be new data in the future with these wearables that I talked about, but there's a lot of healthcare data we could use. Real-world evidence, you can call it that if you want. Real-world data. There has to be a life cycle approach to the generation of evidence. You design upfront what is in clinical trials and what's its data capture from the real world, and then apply that in both the regulatory and payer situation in a more iterative way of deciding on medicines. And I guess devices as well. And finally, this, I guess under this chapter comes innovation not only with medicines and devices, but also with the IT tools. We heard the commendable approach by the European Commission to work on self-regulatory standards for the IT industry, so that they can partner with the pharmaceutical industry and the medical device industry. So this somehow would be, these points will be reflected in one of the bullets in the roadmap.
Okay, thank you very much. Nina, you have number 1, which is prevent health inequalities by developing cost-efficient health system.
We framed according to the P's that the Commissioner spoke about. So what I'm focusing on is prevention. So I think we have now the building blocks of a roadmap, maybe from Riga. These should be refined. These should be where we can all agree, and rather than just a proliferation and a wish list. I think that's important. We each have our own lens, obviously, but we can focus down. Maybe have a set of policy-focused recommendations emanating from here. Last time around in Vilnius, we had a very clear top priority. And that was increasing investment in health promotion and disease prevention. If anything, that call has become even more urgent in the last 2 years. Inequalities going upwards, affordability, accessibility very clearly going downwards. And we're talking about affordability and accessibility for everybody. So vulnerable groups have come through very clearly today, but I think more than ever, it's the people in the middle. If you look at Greece now, it's not just vulnerable groups, it's actually across the board, pensioners, working poor, all need to be taken into account to guarantee access for everybody. And it's not only the decisions inside our health systems, but as we were just saying, especially the ones outside our health systems that are incredibly relevant here. So what's come through is we need to identify smarter ways of preventing avoidable conditions, promoting health across all stages of life, looking at the different policy measures that could achieve that. Last time in Vilnius, I think we discussed quite a lot on fiscal measures. And there are several policy points, whether we're talking about unhealthy foods, whether we're talking about alcohol, where the EU actually actively prevents member states, sovereign governments from doing very, very smart preventative things in terms of preventative action. We didn't have time to discuss very much, regrettably. We discussed on the side yesterday, but antibiotic resistance. That was something that I think had a very, very clear majority behind it when the question was asked yesterday. Looking at promoting initiatives, also regulatory action we talked about yesterday, up and down the supply chain, from environmental release of active substances to overprescription, how this is dealt with human veterinary medicine. Extremely interesting. I'm sure we'll come back much more to this. Improving universal access of affordable medicines and care services, creating conditions to better manage disease, prevent avoidable health deterioration. We just touched on specifically looking at a policy-focused or EU policy-focused agenda, the European semester. At the moment, this is all about cost containment. As I said yesterday, it's really a missed opportunity, the country-specific recommendations of this year. The EU is starting very much to develop a strong evidence base, I think across the board for everything we've discussed. Maybe this is an overarching theme, that the evidence base for policy making is absolutely there. The health community as a whole, we're calling very much for the same things. We're calling very much, very actively, very strongly for preventative measures especially. So what's really lacking now is political will. And unfortunately, in the last 2 years, there's been a lot of good words, but not very much putting money where our mouths are to follow this up, which is regrettable. So that, I think, the coming together of the health community to call for actual action at this time, this is maybe our failure so far, but this is the challenge to us now, whether we're talking about 2020 or whether we're talking about Luxembourg or Amsterdam. This is what we need to do.
Okay, good. We can bring that to Oslo. Adrian, ensure universal access to high-quality, people-centered health services.
Well, thank you very much. And I just want to echo a little bit Nina's point. I think one of the main takeaways for me from this conference is that the stakeholders and all of the participants in this room are going to have to work a lot harder if we actually want to defend the approach to universal healthcare. And I think by 2020, if we don't succeed, the people sitting up here in the room will be private insurance companies offering a variety of scenarios that people can choose from, which would lead to a lot of exclusion of people from healthcare. And I think that's unfortunately where we might be heading if we don't work much, much harder as a team, and I say that genuinely, to deliver on some of these. So I'm going to take you through some of the thoughts, but also underline why we need not just the stakeholders, but many of the academic and other experts here, because we also have to be credible with the data that we are providing to the policymakers to show that this really delivers. So one of the points we say is that the EU, and this I genuinely believe, needs a concrete strategy to ensure equity of access across the European Union. And there's really a role for the EU to be much more active here. And I think just citing Professor Callow, who intervened in one of the discussions, he questioned very openly whether or not the Commission, by not acting in some areas, and especially around ERP and these types of issues, whether the Commission was in a way accentuating or allowing certain member states to accentuate those differences between Central and Eastern Europe and Western Europe. And I think that's something we should really take up and make sure that the Commission is evaluating whether or not it's being fair to its own members by not taking action in this regard. I think also Peter mentioned very much the issue of vulnerable groups. In some countries, vulnerable groups like prisoners are I believe in some ways well taken care of. In other countries, I think there's really an issue to be explored here, and that's something that needs to be taken on. Another key point that we raised is around early dialogue for personalized healthcare, and I think there Professor Razi from the EMA really underlined that we are evolving in terms of medicine's development away from always having a focus on randomized clinical trials towards a real-world evidence approach, and I think that's also to a certain extent happening in other medicines developments as well. And so this is something, of course, that can be taken forward and can be also a key driver to bring sustainable innovation forward and access for patients. Another key point is the stakeholder partnership, which I was referring to a little bit more, and what we can all do together to improve access. Our role, and I think Monika Kaczynska from the WHO, she was highlighting that we need to take leadership. We are also the ones that need to drive the leadership. It's not just to complain to the politicians to deliver for us, but we need to drive that leadership through. And I think we can do that. And I think part of the exercise here is that we are not always seeing eye to eye on every single issue across the stakeholder community, but through the dialogue, we see much closer eye to eye, I'd say, and really can work together on important projects. Another key point is to improve education about biosimilar medicines. And I think Professor Cornes made a very good presentation about the important role this already plays and can play in the future, for instance, in the oncology space, where really there is still some need to accelerate that, and he gave the example of filgrastim. Another key component, just touching on what Richard said, was including ways to measure access in terms of the EU semester process, so to make sure that we shift the EU semester process from a cost containment exercise to an efficiency of access exercise. And I think if you believe in universal health, this is what it's about. We need to deliver better access, better treatments, of course, in the most efficient way. And that's for us, the stakeholders, as well, to contribute to that efficiency. And I think here, Joe de Kock signaled that the European Council may indeed be taking up part of this issue, not the whole thing, but part of it with this horizon planning approach, looking forward to what's coming down so there could be more predictability for everybody involved. And I think that's really important that we move forward in that more predictable way. And I'd like to see more from Joe de Kock and from the Council on that. Another key component that was raised was the brain drain for healthcare professionals. So this is to make sure that everybody, regardless of where they reside, in terms of the wealth of the country or in the countryside or in the city, that they can also have access to quality healthcare professional services. And I think one of the compelling things that was presented by Gunta Anka, who's a patient representative here from Latvia, she alerted us in one of the slides, which probably you saw was also retweeted, showed you the number of Latvian patients who basically say they can't afford their healthcare. Or are very deeply concerned about whether or not they can afford it. And if you think that, here we are in a small but important European country that so many patients have that deep concern, I think we should be deeply concerned about that as well. And it should compel all of us, the stakeholders, to be much, much more engaged and to drive this agenda forward. I think with a little bit more of the energy that Nina delivers. So Richard, come on, give us a little bit more energy, please.
Okay. Fourth is develop participatory, people-centered health system. To cope with the chance of chronic diseases, health systems need to stop being disease-centered and adopt a person-centered approach where self-management, community and specialist medical care and social care are integrated in a highly personalized solution centered on the needs of the patients. The patient in this vision is an active and equal partner and truly a co-producer of well-being. This implies changes at all levels in how care is structured and delivered. It also implies a profound change in medical culture. And it implies the empowerment of patients and their participation, not only in their own care, but also through patient organization, in policy making, in co-designing care service, and in research to develop new therapies that meet patient need more effectively. I am, EPFR, gratified to see that the recommendation included in the Riga Roadmap on participatory health system have mostly received an overwhelmingly positive response from you, the audience, over these 2 days. If I may, I will just pick up some of the recommendations that we consider especially important. One is specific research supported by the EU on innovation of system and organization for healthcare to meet patients' need better, based on a gap analysis from a patient perspective. This is absolutely vital, because innovation for us does not only mean therapeutical innovation important as it is, but also looking at areas such as integration of care, participatory medicine, and organizational culture change. Second is developing a European strategy on patient empowerment, including a repository of good practices. This is vital for mutual learning and inspiration. We already know that much is happening across the EU, but we still have no comprehensive overview. Third, ensuring meaningful involvement of patients along with civil society and consumer organizations in the development of policies and programs at EU and national level. We patients are unlike the other stakeholders. It is our health and ultimately our life that is on stake. We have the experience of what it means to live with the condition. We have done the patient journey and what it means to navigate the healthcare systems. Finally, developing tools to evaluation of patient person-centeredness as a key aspect of quality of healthcare under the EU Health System Performance Assessment Framework. Addressing patient-centeredness within the HSPA process together with patient organization will be an important signal at the highest political level that patient matters. So we think this is a truly strong move forward. And I would like to add to this that this Riga Roadmap will continue to work with us for partners here and will build disseminated in the course of published online, so we'll see that in a short time, so we will work on that. And all the survey, the question we have heard and seen and we have voted on has also been linked to the roadmap, so that is into the roadmap. So, we sang yesterday when we finished, what did we learn in school today? I'm not going to sing today, so I hope you all have learned anything. And I'm extremely happy on behalf of the organizer to thank everyone that's organizing it and also the participation, and you have been here, taking your time, taking the truly thoughts and wishes and brought it forward, and to struggle and meet both challenges and goodwill and everything. So I thank you very much, unless there is something urgent you want to say, like it's fire in somewhere, we need to go that way or something like that? No, nothing like that?
One very quick note. Since this is, we have a bit of a schools out feeling.
Yeah.
End
The
of June,
summer-
start
summer
of July, summer break, at
Yeah.
least the good people of Brussels tend to disappear for the next few months and turn it into a ghost town. But I just wanted to extend an invitation for those who've missed, especially a bit of a more in-depth discussion on social determinants of health and inequalities. EPHA's annual conference will be one of the first back-to-school events in Brussels on the 2nd and 3rd of September, where we'll be discussing, amongst others, with the Greek Health Minister, Dr. Kouroumplis. So we were discussing 2020, whether we might have a Norwegian presidency Oslo roadmap. We actually don't know where we're going to be in 2 weeks in terms of the member states of the Union.
You said the Greek minister.
Greek Minister of Health.
Greek Minister of Health, it will be.
Current Greek Minister of Health.
Okay.
So let's see. I mean, let's hear about what happens to a country when you don't just have a run on the banks, but you also have a run on the pharmacies. It will be fascinating to hear his views.
Okay. Good. We have something to do after summer break. Thank you.
Just one small thing, also to thank all the people who put the hard work into organizing this conference. So Kaisa, Clara, Elizabeth, Kolya, I'm not sure where she's disappeared to, and also to Vital Transformation. Dwayne has also apparently gone back to the karaoke bar. And Petra, of course, standing over there, and the whole team from Vital Transformation. I think you also did a wonderful job in setting this up.
So then,
So, enjoy the summer and enjoy the future. See you in Oslo.